Hello, my name is Gina, and I am currently a nursing student at Excelsior University. I would have to say, as a result of the program, I have benefited greatly. I would have to say that I am more confident with my test-taking skills, as well as understanding clinical concepts better, as well as clinical conditions better than when I did when I was in LPN school, and even as in my current career as an LPN, as I do now. During my clinical experience at Ellis Hospital, I provided patient-centered care for all my patients, but in different ways. For all my patients, I took the time to introduce myself to them, learn their history and current diagnosis, and medications and home situation. One patient in particular was an elderly woman with back pain. After assessing her back, I reported the patient's discomfort to the nurse caring for her as well as my clinical instructor. Together, we determined that she can have her pain medication as well as a back rub. Before administering the medication, I verified her identification and allergies, documented her pain level, and verified the 5 rights of medication administration. Once the medication was administered, I offered her a gentle back rub. After 10 to 15 minutes of rubbing her back, I noticed she was finally starting to relax. I let her rest and came back to her after 30 minutes total to assess her pain level. Thankfully, she scored her pain as a 1 to a 10 and stated she feels tired and wants to sleep. So I did leave the room and let her rest. This experience made me feel happy and relieved for her as well. It made me feel proud of my efforts to help manage her pain and that I was able to help her feel better. Times like this when the actions you take actually help a patient feel better, no matter their complaint may be, it always makes me feel proud to be a nurse and always validates the reasons why I went into nursing. I am a caring and empathetic person, and I always wanted to care for people and help them feel good. When I make someone feel better, I feel better. In this particular situation, I felt I handled the situation appropriately. I feel the back rub was a nursing action that demonstrated my ability to provide care in a holistic manner. I think going forward, I'm going to remind myself of the holistic interventions that can help a patient in addition to medication therapy, because in this case, it had a positive outcome. I believe when administering a medication, one must always practice the 5 rights to keep the patient safe. It also requires an attitude of willingness to take the time to treat them individually according to their specific needs, especially when you can apply holistic actions or interventions. When put into practice, these skills and attitudes will result with patient satisfaction, positive outcomes, and maintaining patient safety. This experience also made me a better nurse by being more aware of how I should not use only the pain medication as the sole intervention. I will be honest, when she was in pain, I automatically thought of medication therapy, and the back rub did not enter my mind until I consulted with the RN and my instructor. I had forgotten that a gentle human touch, is soothing and can make a big difference. So can other measures such as relaxing music, aromatherapy, dim lighting. As far as the person who helped in this situation and deserves acknowledgement is the RN who advised me to offer the gentle massage. Without her, that idea would never have entered my mind because I was nervous about being at clinical, and the outcome could have been different. The outcome could have been different, and I would not have had the sense of pride of helping soothe someone in such a personal and caring way. It was a win. Thanks for listening.